So thank you everyone for joining us today. As Janet mentioned, we're here to discuss complying with the COVID-19 Response and Reopening Liability Assurance Act. We do have a lot to cover, and so we're going to go through it pretty quickly. But like Janet said, please feel free to post any questions in the chat box during the presentation, and then we'll also have time for questions at the end. So to set the stage, we'll have Dominic first discuss the Michigan Department of Health and Human Services epidemic orders and the executive order. Then I'll discuss the Michigan Occupational Safety and Health Administration emergency rules and certain Center for Disease Control guidelines. I'll also discuss the language contained in the COVID-19 Response and Reopening Liability Assurance Act, as well as areas of safe harbor. Finally, we'll have John discuss the future state of complying with COVID-19 regulations and share a few hypothetical situations to illustrate how employers can protect themselves from liability under the Act. All right, now over to Dominic.
Good afternoon, everybody. And as I started off the presentation last time, it still holds true that the Michigan Department of Health and Human Services epidemic orders are nothing but a series of revolving doors that keep on spinning and rotating as we move through the COVID-19 pandemic. As a general overview, to date, the MDHHS has issued a total of actually not 44 different orders, but as of Monday, now 46 orders. And of those 46 orders, instead of 22, 24 of them have since been rescinded. Now, many of the rescinded orders still impact potential COVID-19 related claims because COVID-19 claims or potential claims relate back to the date of exposure. Therefore, making sure that you comply with the orders in place at the date of a COVID-19 exposure in your workplace or in your facility is key to optimizing protection under the Liability Act. Now, again, just a series of orders. These are 44 of the 46 orders that have been issued by the Michigan Department of Health and Human Services. And just as a little picture demonstration, over half of them have since been rescinded. Now, during our last presentation, we went over a series of orders from April to November that highlighted many of the compliance aspects that you needed to follow at those specific dates. I'm not going to go over all of these specific orders again here during this presentation, trying to update more on where we left off to where we are today, but I believe we did provide that presentation to BOMA and it was available on the website. But if you want additional information on the orders that we previously presented on, feel free to let me know, let John know, let Janet know, and we can get you that additional information as soon as we can. Now, since our last session, the MDHHS issued not 5, but 6 orders that we believe could be applicable to BOMA and BOMA members. In addition to that February 4th order, there was an order issued on March 22nd, which expanded a lot of the previous restrictions for stadiums, restaurants, and other types of facilities that I'll go over in a little more detail later in this presentation. Starting with the December 7th order on reopening. This order allowed the reopening of many services and businesses that we've been missing over the last year, including hair salons, 25 people outdoor gatherings, gyms, ice rinks, pool, retail, outdoor dining and delivery, childcare, funerals, and other aspects of construction. However, as I'm sure we are all accustomed to by now, face masks and social distancing remain the forefront for a lot of these businesses and services. In addition to requiring face masks and social distancing, the MDHHS set occupancy limits for many services and and facilities. For instance, retail was limited to 30% total occupancy. Gyms had, they were limited to 25% occupancy and needed to maintain at least 12 feet of distance between workout stations. Outpatient facilities and veterinarian facilities, persons not in the same household needed to remain 6 feet apart or more from each other. Ice rinks were finally allowed to reopen, limited to 20 people per 1,000 square feet. I believe that works out to approximately, I think it was 175 for a sheet of ice, maybe 150. And care services, tattoo studios, hair salons, piercing studios, gatherings were allowed so long as the services requested didn't involve removing your mask. Now, following the December 7th order, the MDHHS issued an additional order on December 18th, which again allowed for the reopening of additional services and businesses that we hadn't seen in almost a year. This allowed for the reopening of theaters, arenas, bowling centers, bingo halls, arcades, outdoor group fitness classes, which I thought was a little strange, saying that it was the middle of December. Entertainment facilities had restrictions that had to be complied with. No more than 6 people from the same household in a shared space. And again, masks and social distancing maintained needed to be at the forefront. I know no food or beverage sold or consumed on the premises. I know this was the center of a lot of controversy with bowling alleys. Who goes bowling and doesn't have a drink or a slice of pizza? And since December 18th order superseded the previous December 7th order, it also set out a lot of the same limitations previously provided by the MDHHS. So although the December 7th order was quote unquote rescinded, a lot of the occupancy limitations, in fact, all of the occupancy limitations that the December 7th order set in place were restated in the December 18th order. So retail occupancy needed to remain 30% or less, gyms 25% occupancy, ice rinks 20 people per 1,000 square feet, and care services gatherings were allowed so long as it didn't involve removing your mask. On January 13th, the Michigan Department of Health and Human Services issued and further orders allowing for more reopening of things we've been missing. This included your indoor fitness classes, yoga studios, cycling bars, jazzercise classes, boot camp classes. These group fitness classes were permitted, provided that all persons remain 6 feet apart from one another and then remain masked for the duration of their workout. Another important aspect of the January 13th order was non-contact sports were allowed to resume. Swimming, tennis, other non-contact sports, and gatherings and participants were allowed to spectate these sports so long as the arena, or I guess the pool, didn't exceed 25% of the total occupancy. Again, masks are required, and the participants in the event needed to maintain 6 feet social distancing from one another. And one that I think everybody was looking forward to was the January 22nd order, which allowed for the reopening of restaurants and bars. The Michigan Department of Health and Human Services stated that these places could reopen as long as they had designated dining areas for groups no more than 6 people per group to eat and consume their beverages. Again, these groups, these tables needed to be spaced at least 6 feet apart from one another, and restaurants and bars were limited to 25% occupancy or 100 people, whatever was less. Another aspect of this order was that these restaurants and bars, they couldn't remain open past 10 o'clock, and they couldn't reopen the following day until after 4 o'clock in the morning. The MDHHS also stated that, there is a possibility that employees working at these establishments could test positive for COVID-19. If they do test positive, or they have an employee showing symptoms that they could have contracted the virus, gathering at these establishments will be prohibited until the establishment has performed a deep clean of their space, consistent with the CDC guidelines. On February 4th, the MDHHS issued an additional order that allowed contact sports to resume in Michigan. The participants within your facilities must remain masked the entire time, and if you're unable to do so, all participants must be tested and confirmed negative before participating in the contact sport. Gathering of participants is prohibited unless social distancing can be maintained when not engaged. One example of this is, I'm sure maybe some of you are big into March Madness as I am. You take a look on the court and you notice that the bench next to the coach is seemingly empty. But when they pan out, you see all of the players basically spread out 6 feet apart along the first few rows of seating in the stadium. And although this might not be in Michigan, for instance, Indiana have similar guidelines to that of Michigan, and that's the reason behind seeing the participants just hanging out in the stands. Another thing that this order maintained was that sports organizers, venues, and teams must make sure strict compliance with the social distancing rules. And the organizers are encouraged to administer testing program consistent with the CDC. Now, although I don't have a slide for this next one, there is an infographic on the MDHHS website that really does well highlighting the March 22nd order, like I had said before, just put into place on Monday. And this is effective from March 22nd until April 19th. Now, the MDHHS issued new protocol that limits attendance at gatherings and non-residential gatherings. Now, for residential gatherings occurring indoors, you can have up to 15 persons from 3 different households, which is different from the previous order, which only allowed, I believe it was 10 from 2 different households. Interestingly enough, the MDHHS is now taking into consideration the vaccination of individuals. And they specifically state that fully vaccinated individuals may remove their masks at these residential gatherings so long as 2 weeks have passed since their final dosage of the COVID-19 vaccine. This is the first time we're seeing that vaccination is playing a part in the MDHHS guidelines, but I anticipate further guidance regarding vaccines and possible reopening in the future. However, at non-residential gatherings, there is no such vaccination, quote unquote, exception to removing your mask. Masks are still mandatory for non-residential gatherings, and non-residential gatherings occurring indoors are limited to 25 people and outdoors 300 people. Again, the MDHHS is not, they're not leaving their, they're not, I don't say leaving, but they're not getting rid of their face mask requirement. And they specifically state that businesses, government offices, schools, childcare organizations, operators of public transit, and any other gathering organization must require individuals to wear a mask. And if the person responsible for the entity, the organization, for the business, does see somebody without a mask, it is that person's responsibility to inquire whether or not they fall into one of the exceptions to not wearing a mask, such as, it causes poses some kind of health risk to the individual, or if it's a child, if the child is under the age of 7. Now, what the order also outlined was that recreation and entertainment venues are allowed to be reopened to individuals and groups of people up to 25 persons. This goes for auditoriums, arenas, concert halls, bowling alleys, gun ranges, laser tag, trampoline parks, and these indoor facilities are they're allowed to operate at 50% of the limits established by the fire marshal. Now, for food and service, the MDHHS laid out additional, I wouldn't say guidelines, but they broadened their horizons on, the amount of people and the time frame these establishments can be open. Indoor and outdoor dining is now allowed, instead of going to 10 o'clock, they're open till 11. And indoor dining, instead of having 25% occupancy, they're allowed to push 50% occupancy. And if they have an outdoor patio, fair game, 100% occupancy for any outdoor dining space at these establishments. But again, face masks are required so long as you're up, about, moving around. If you're seated at your table, if you're seated at the bar, then you are able to remove your mask. Now, I had talked a little bit earlier about rescission, and you see on that infographic that I put together, there were a lot of red marks of these orders that have been rescinded by previous order or by subsequent orders issued by MDHHS. Now, it's important to note that although the December 7th, 18th, January 13th, and 22nd orders have been rescinded, the guidance and rules behind them are each reaffirmed in the subsequent orders. Therefore, you got to continue following the guidance laid out in the orders as you establish and reopen businesses and services. Another important note with each of these orders is the requirement for contact tracing. Gatherings of any type are prohibited unless the facility maintains accurate records of the date, time, name of the people, and contact information of each patron that comes into the establishment. This goes for businesses providing hair services, nail, tanning, massage, spa, tattoo parlors, body art, piercing services, and even exercise facilities. All need to maintain accurate records. For in-home services, although maybe not part of BOMA, they must, businesses providing in-home services must not permit their employees to gather with clients unless the business maintains appointment records, including date and time of service, and the name of the client and contact information. And the same goes for dine-in food services. These kind of businesses must maintain accurate records of name and phone numbers of everybody who purchases and consumes any food or drink on the premises. Now, why is this important? Because at any time, the MDHHS can request that your business or facility provide list of names, phone numbers, and of individuals who had been within your facility at any given time to aid in contact tracing for COVID-19. So it's very important to make sure your facilities, your tenants are keeping accurate records to avoid potential liability down the road. And with that, I'm going to hand it over to Caitlin Elias to give you a little update on MIOSHA and the Health Administration COVID-19 emergency rules. Caitlin, we can't hear you.
Sorry. Before I wanted to jump into the MIOSHA rules, I do want to address Dan's question that just came through the Q&A box. He asked, is there an assumed longevity for the vaccine effectiveness yet? Is there a time and place for when vaccines need to be re-administered to be considered effective and able to go back out in public? So from everything I've heard, I haven't heard of the longevity answer yet. I did just have a conversation with my doctor earlier this week about vaccines, and there's still a lot of unknowns about how long the vaccine's lasting. And so that's definitely a great question, and something that we'll make a note of for probably a future BOMA presentation. I don't know if Dom or John, you have anything else you want to add to that answer? Okay. All right, great. So with that, I'm going to jump into the MIOSHA rules. So just to summarize, so businesses must comply with the COVID-19 rules from the Michigan Department of Health and Human Services, as well as the rules from the Michigan Occupational Safety and Health Administration. So Dom just went over all the MDHHS rules, and now I'll review the applicable MIOSHA COVID-19 emergency rules. So on October 14, 2020, MIOSHA issued emergency rules, and MIOSHA covers pretty much every employer in Michigan with some exceptions, but by and large, every employer and employee must comply with these emergency rules, which MIOSHA expects to be in place until at least mid-April. We haven't heard yet whether these rules will be extended, but it is likely at least an amended version of them will still be in place for a few more months. So there's a lot of consistency between these rules and the DHHS epidemic orders and the executive orders. So for example, they all require employers to develop a COVID-19 preparedness and response plan. Under MIOSHA, the plan must be consistent with the CDC and the Federal Occupational Safety and Health Administration. An additional requirement under MIOSHA is that employers have to categorize each job at their work site into risk categories. Next slide. So regarding the risk categories, the types of jobs are divided into low risk, medium risk, high, and very high risk. Low risk requires minimal contact with the public and other coworkers, while medium risk requires frequent or close contact with the public, including people who may be infected with COVID-19, but who are not known or suspected COVID-19 patients. This includes work settings such as schools and retail high volume establishments. The high and very high risk categories are for jobs such as healthcare professionals, first responders, nursing home employees, law enforcement, correctional officers, and mortuary workers. Next slide. So now, since most BOMA members fall under the low and medium risk categories, I'm going to focus on the requirements for those work settings. First and foremost is the importance of face coverings. Employers must provide non-medical grade face coverings to their employees who must wear them in shared spaces and when they cannot maintain 6 feet of separation, and they must consider face shields when they can't maintain more than 3 feet of separation. So anyone that's gone to the hair salon, you know that the person doing your hair is wearing the face shield because it's really hard to do that 6 feet apart. So one of the challenges with this virus is that about 40% of the spread is believed to come from those who are asymptomatic, which means they are never going to get sick. They're going to carry and transmit the virus, but they won't show symptoms, which means that face coverings and social distancing is that much more critical. Face coverings can reduce transmission by about 70% since the virus is largely transmitted through aerosols that come out of us when we cough, sneeze, sing, and shout. We've seen, however, that compliance with face coverings is inconsistent across work environments. In Michigan, DHHS has been tracking outbreaks since the beginning, and in data they post every Monday, it shows strong outbreaks across industries. When we focus in on workplace outbreaks, excluding schools and nursing homes, DHHS is tracking about 210 ongoing outbreaks, and about 63 of those are associated with construction or manufacturing sites. In those situations, it's the employees bringing it into the work site, so employers need to be diligent about the workplace controls listed on this slide. That includes daily health screenings, face coverings, and maintaining social distancing. So with the case rates in Michigan spiking now, and I think last time I checked, they're at about 12% positivity rates, we know COVID is going to come into the workplace, so we need to be prepared to handle that. And this is, despite the increase in vaccines that we're seeing right now. Some of the things MIOSHA requires is the designation of a COVID-19 safety coordinator. This person does not have to be management, but they do need to be at the site for the duration of the day to assure compliance with the MIOSHA rules. That includes the daily health screenings, which must include a questionnaire to check for symptoms, as well as wearing face coverings and being able to report back to somebody if those things are not happening. Multiple people can serve as the safety coordinators. The purpose is employees have to know who they can contact during their shift to address COVID-19 concerns. The MIOSHA rules also require employers to conduct trainings for employees on how COVID spreads, how they enforce their rights, and how they report signs and symptoms. Next slide. So regarding the rules on remote work, which are still in place at this time, MIOSHA requires employers to create a policy prohibiting in-person work for employees to the extent that their work activities can feasibly be completed remotely. So on a job site where you must physically be present to use your hands, like in the trades, it's more than likely you cannot work remotely. But for office staff, you're going to need a remote work policy as part of the preparedness and response plan, or you can have it as a standalone written policy. Employers need to identify which positions are reporting for in-person work and why they must be physically present, and the reasons they cannot work, the work cannot be performed remotely. The policy needs to be specific enough to show that you've done a reasoned and thoughtful analysis of who must be in the workplace. To reduce the spread and the number of positive cases, MIOSHA is focused on getting people out of the workplace. With that said, MIOSHA has indicated it understands there are some positions, even in office settings, that have to be performed in person, but everyone else should work from home as much as possible to help mitigate the potential spread. Next slide. So regarding quarantine and isolation, employers are obligated to isolate any employees who are known or suspected to have COVID. This would include those that have symptoms but have not been tested, or those who are close contacts with somebody that was confirmed to have COVID. Employers need to keep these individuals out of the workplace and separated from the rest of the workforce. The way that quarantine and isolation works is MIOSHA refers to the CDC guidelines on quarantine and isolation. So quarantine is going to be for somebody who is a close contact of a known COVID case, and they're going to need to quarantine for 14 days from that last close contact. A negative test does not get you out of quarantine because symptoms can develop anytime during that 14-day period, so you must quarantine them for those 14 days. Isolation is when somebody has symptoms or they are confirmed through a positive test when they have no symptoms. Isolation must occur for 10 days from when their symptoms first appear or when they had a confirmed test and symptoms never appeared, and they have had 24 hours with no fever without taking medications and the other symptoms are starting to improve. So regarding critical infrastructure industries, the isolation rules still apply, but there are alternative quarantine guidelines under the CDC for very limited critical infrastructure industries. The FAQs on the MIOSHA website go into further detail regarding when the critical infrastructure guidelines might be applicable. I also want to make a note about people that have vaccines. So what I heard, and I encourage everyone to visit the CDC website for further guidance on this, but if somebody has received the vaccine and then, for example, they come into contact with somebody who has COVID, that these timelines are shortened for them. So somebody that's received the vaccine and they've come into close contact with somebody with COVID does not have to quarantine for the full 14 days. I believe they have to quarantine for 5 days, and as long as they don't show symptoms, then they're able to come back to work. Next slide. So regarding record-keeping requirements, employers must maintain a record of all COVID-19 employee trainings, a log of the daily health screenings, and a record of all notifications to the Public Health Department, coworkers, contractors, and suppliers regarding known COVID cases. And all employers have to maintain these records for 1 year from the time that they're generated. So this next section is on industry-specific requirements. So for the construction industry, there needs to be specific entry points onto the worksite where the daily screenings will occur. Or in the alternative, the employer can issue stickers or other indicators to the employees to show they received a screening before entering the worksite that day. In high-risk areas like hallways, elevators, and break areas, there needs to be access control and/or physical barriers in place to keep social distancing in place. And there needs to also be protocols for minimizing personal contact when materials are delivered to the worksite. In the manufacturing setting, again, there needs to be dedicated entry points at every facility for the daily health screenings, and there must be physical barriers in place to prevent employees from bypassing the screening. And also there needs to be protocols in place for minimizing personal contact during the delivery of materials to the facility. For retail establishments, the business must require patrons to wear a face covering, and there must be signs at the entrances instructing patrons to do so. The spaces in stores must be designed to encourage employees and patrons to maintain social distancing, and there must be physical barriers at checkout, including plexiglass barriers, tape markers, or tables. Additionally, retail establishments must have enhanced cleaning and sanitizing protocol for high-touch areas like restrooms, the credit card machines, the keypads, the counters, shopping carts, and other surfaces. For restaurants and bars, social distancing between parties or groups at different tables must be in place, and when customers are required to wear a face covering except when they are seated at their table. Signs must be posted at the entrances requiring face coverings and customers not to enter if they are sick, and hosts, servers, and staff must wear face coverings in the dining area and wherever social distancing cannot be maintained. For those members with healthcare facilities on their property, including outpatient healthcare facilities, clinics, primary care physician offices, dental offices, and veterinary clinics, employers must again post signs at the entrances requiring face coverings, but patients can remove them as necessary for identification or to facilitate an examination. Waiting areas must be arranged to allow for social distancing, and it's encouraged for customers to still wait in their cars if possible. A screening of patients for COVID symptoms, including a temperature check, must be conducted, and hand sanitizer and face coverings must be placed at the patient entrances. For in-home service providers, including cleaners, repair persons, painters, and the like, businesses must maintain accurate appointment records, including date and time of service, the name of the client, and the contact information to aid with contact tracing. Before the employee enters the home, they must also inquire with the customer whether anyone in the household has been diagnosed with COVID, is experiencing symptoms, or has had close contact with someone who has been diagnosed. If yes, then the appointment must be rescheduled. For personal care services such as barbershops, cosmetology services, tattoo parlors, tanning salons, and massage parlors, the businesses must post signs at the entrance, arrange waiting areas to maintain social distancing, and require employees and customers to wear face coverings at all times. These businesses must also restrict entry to customers, caregivers of those customers, and minor dependents of those customers. Additionally, these businesses must discard the magazine stationed in waiting areas and other non-essential shared items that cannot be disinfected. Next, we have public accommodation businesses such as arenas, cinemas, performance venues, arcades, bowling alleys, nightclubs, and skating rinks, which, in addition to requiring face coverings and posting signs, must also establish crowd limiting measures to meter the flow of customers, and entertainment facilities must establish safe exit procedures. Finally, all gyms, fitness centers, recreation centers, exercise studios, and the like must post signs, mandate face coverings except while swimming, provide equipment cleaning products throughout the facility, and ensure the ventilation systems operate properly. So as far as enforcement of MIOSHA rules, employers can face fines of up to $7,000 for deficiencies in the preparedness and response plan or for failure to comply with the remote work requirements. On November 5th, MIOSHA issued a statement it would start conducting inspections at office settings to review whether the rules are being followed. And in late November, MIOSHA launched a state emphasis program designed at construction where MIOSHA randomly selects construction sites across the state of Michigan and drops in without giving notice to the employer. MIOSHA officers announce themselves when they get there and conduct an inspection to seek compliance with the MIOSHA rules. On February 5th, MIOSHA released information on its latest round of COVID-19 emergency rule citations, which were issued to 10 different companies. Deficiencies included lack of health screenings, face coverings, employee training, and overall preparedness plans. One of the must-haves is a preparedness and response plan. If you don't have one of those already, MIOSHA does have sample preparedness and response plans for low and medium risk workplaces available at their website, as well as sample reopening checklists. Their website also has comprehensive FAQs, posters, videos, and other tools. So a MIOSHA hotline for employers and employees to use if they have questions about compliance. Finally, there's a consultation program in place called the Ambassador Program, which is a proactive program where consultants will stop in at businesses that are open to the public, such as restaurants, bars, and gyms, and provide consultations, education, and support to businesses on compliance with any of the aspects of the MIOSHA emergency rules. Ambassadors can also provide consultations over the phone and via email. Next slide. So this next slide has information about a program MIOSHA is highlighting called Michigan Saves, which helps small businesses make improvements to the energy efficiency of their buildings, primarily to upgrade the HVAC system so the businesses better protect employees and customers from COVID. The program assists with all types of businesses, nonprofits, the public sector, and multifamily housing with financing of up to $2 million for energy improvements through a collaboration with Consumers Energy, DTE, and SEMCO. The contact information for further details on the program is provided at the bottom. And with that, we've now set the stage to discuss liability protection under the recent COVID-19 Response and Reopening Liability Assurance Act. So this is the act that was enacted on October 22nd, 2020, 20 days after the Michigan Supreme Court invalidated Governor Whitmer's ability to enact executive orders under the Emergency Powers of Government Act in a 4-3 decision from the Supreme Court. So this act is the product of 3 bills approved by the House of Representatives before the Supreme Court's decision. And those 3 bills are HB 6030, HB 6031, and HB 6032. I'm going to go over each of these bills and then provide additional information at the end. So HB 6030, which is known as Public Act 236 of 2020, the most important aspects and provisions in this bill include Section 2, which provides definitions applying throughout the act, which include a COVID-19 claim as well as conduct intended to reduce transmission of COVID-19. Section 5 is the meat of the statute. So for property owners and managers, it's important to realize that a person includes businesses, government, and nonprofits who acts in compliance with all federal, state, and local statutes, rules, regulations, executive orders, and agency orders related to COVID-19 that had not been denied legal effect at the time of the conduct or risk that allegedly caused harm is immune from liability for a COVID-19 claim. So just to kind of summarize, if you are a business and you are acting in compliance with all federal, state, and local statutes, as well as all the rules and regulations and executive orders and agency orders, which we just covered, that are all related to COVID-19, and those at the time of the conduct or the risk that might cause harm related to COVID, and those were, if you were compliant with the rules and laws that were in effect at that time, then your business is going to be immune from being liable for a COVID-19 claim. The other parts of these of HB 6030, so Section 5 provides an additional protection, and it states an isolated de minimis deviation from strict compliance with such statutes, rules, regulations, executive orders, and agency orders unrelated to the plaintiff's injuries does not deny a person immunity. So that means that, say for example, you're operating a gym and you're compliant, you have a group fitness class that comes in, and when that, whoever, gets COVID or has COVID, they come into the gym and maybe you're complying, everybody's complying, everybody's wearing their face mask. But during that session, somebody else gets COVID because that other person brought it into the business. and that other person that gets COVID says that they want to blame you for contracting COVID. If there's a deviation, so say in another class at a different time that's unrelated to that person, somebody wasn't wearing their mask for a little bit, that is considered a de minimis deviation from strict compliance, and it's unrelated to this other person that's saying that they contracted COVID at your location. And so that's not going to prevent you from having immunity under this act. Section 8 makes it clear that the liability protection does not constitute a defense to liability in an administrative proceeding or civil action brought by state or local government, prosecutor, or agency to enforce statutes and regulations, executive orders, or state agencies applicable to COVID-19. So again, this liability protection does not apply if it's the government or a certain agency that's bringing an action against you based on these COVID-19 rules. It's only providing a liability defense from other people, customers, employees, that kind of thing. So HB 6031, which is known as Public Act 237 of 2020, provides similar liability protections to what exists under the bill I just summarized. Section 85 reads, an employer is not liable under this act for an employer's exposure to COVID-19 if the employer was operating in compliance with all federal, state, and local statutes, rules, and regulations, executive orders, and agency orders related to COVID-19. So again, the same de minimis exception applies as from the previous bill, but now this is applicable to employees and employers. And HB 6032, which is now known as Public Act 238 of 2020. So the first two bills, HB 6030 and 6032, were more about employer liability protection. 6032 is more about employee protection from COVID-19 related to employer action. Section 3 precludes an employer from taking adverse action against an employee under any of the following circumstances. So when an employee tests positive, displays symptoms, and returns and adheres to all the following guidelines before returning to work. So there's been 24 hours since they've had a fever, 10 days passed since they had their symptoms or got a negative test, and the employee's principal symptoms have improved. So if an employee objects to an employer's violation of the act, an employee reports health violations related to COVID-19, this would be examples of the employee taking steps regarding COVID-19, and the employer is prevented from taking an adverse action against that employee. So an employee who tests positive or who displays the principal symptoms cannot return to work until all of the following criteria can be satisfied. 24 hours have passed since the fever, 10 days have passed since the later of first symptoms or a negative test, and the employee's principal symptoms have improved. They cannot come to work unless all those three things are in place. And again, I know there's a lot of redundancy on a lot of this material, but it's all important. An employee with close contact, so that means being within 6 feet for 15 minutes or longer, with someone who tests positive cannot report to work until 14 days have passed since the close contact, or the employee tests positive, or an employee who tests positive receives a medical determination that the positive person was not contagious at the time of the close contact with the employee. So these are the same exact quarantine and isolation guidelines. There are exceptions to this rule for healthcare and other workers. So Bill 6032 does empower an employee to bring a cause of action for a violation of this bill if he or she prevails, she's entitled to at least $5,000 in damages from the employer. So just in summary, the most important parts of the Act, employers must comply with all federal, state, and local laws as it pertains to COVID-19 to obtain immunity. It's important to stay abreast of the law, perhaps implement a daily review of Michigan Department of Health and Human Services and County Health Department websites. We've listed a few of those here relevant to those businesses in Oakland County and Macomb County. If you have a de minimis or, a very, minimal, not serious violation, that those violations do not compromise your liability protection under the Act. This Act is retroactive to any claim or cause of action that accrues after March 1st of 2020. And employers cannot take adverse action against employees taking proper precautions after testing positive or having close contact with a person who tested positive. All right, I think that's all set. John, if you want to take over.
Yeah, and I want to follow up on that last slide, because there's been a whole lot of meat that's been served up and identify this notion of the themes that you can see running through the COVID liability bill and the stakeholders that had some role in the development of the bill. The bill is introduced, and then as it was modified, as it went through the system, so that you can see there were employers that were involved. There were various stakeholders for tenants, different industries and organizations, building owners. BOMA was there as well, and trying to make sure that we did get some sense of immunity through this. Was it a perfect bill? No, it wasn't perfect, and you can see that there's still some things that you have to do in order to obtain that level of protection. But if we jump over to the next slide, you can see that we are one of several states that have been able to obtain some level of legislative protection from any COVID liability. Now, there were some fears early on that there was going to be this wave of litigation with all these people who contracted COVID, and they were going to be blaming some businesses, saying, I went into that business and that was the only place I went. I stayed in my bubble and somehow I contracted COVID. We haven't seen that particular wave of litigation. And even going through all of the various states, and there is, we could throw on the state of Missouri as another one that is in process. Their bill is winding through, but we haven't seen that huge wave. And when we look nationally, we haven't seen a lot of it, but we also can't compare the various states for the types of protections that we each have, because our state has certain protections and immunities. Some states require different levels of compliance. Some states, if it's willful or intentional, then they'll impose liability or create some type of rebuttable presumption that the plaintiff has to overcome when they enter into a business. So we have to be very careful when we're comparing one state's experience to another relative to the immunity, to make sure that we're comparing apples to apples. But right now, the area that's got the most litigation has been the employer-employee context, which is perhaps not surprising. Perhaps what is surprising is at the federal level, there still is no legislative immunity. That was one of the things that held up the COVID, the second COVID relief bill that ultimately was passed, but that didn't include any of the liability protections that had been holding it up for several months before that. So you still have this notion of exposure to COVID creates an argument. But right now, the heavier litigation has been either in the employment context or the business interruption context, where a business is suing their insurance carrier for non-payment of that loss, the loss of business. So what we're looking at is anticipating, well, what is going to be the next growth area and how do we maintain our defenses? And that's where we go to the next slide. And we talk about the safe harbor that was developed in our Immunity Act. And this was something that there were several employer groups, business owners, and associations like BOMA that was trying to push for as expansive a safe harbor as we could get. And we end up, we've got something. Now, this something does require compliance with the federal, state, and local rules. If you're going to seek the protection of the immunity, that means you can't pick and choose on your own which rules you like and which rules you don't. We've been talking a lot about the face coverings and the face masks, and that's going to be the easiest target. If someone does contract COVID and they somehow find a way to link it to your facility or building, that could be one of the arguments that you weren't enforcing a face mask or face covering requirement. Because it is important to note that the COVID immunity bills do not create a cause of action in and of themselves, and they don't eliminate or reduce any requirement for causation or proximate causation. So even if someone brings an action, they've still got to identify it that you are the cause, that somehow you were the one that caused them or exposed them to the virus. So what you need to do is make sure that you've documented compliance with all of the rules and guidelines, so that you can say if there was a violation or if there was a breach, it was de minimis at best, not a big deal, it was too trivial to mention, but compliance is the key. And the idea there is compliance doesn't necessarily prevent litigation. We can go to the next slide. That immunity doesn't mean you're not going to get sued. Immunity just means that you have a defense if you do get sued. And in order to avail yourself of that defense, you're going to need to demonstrate compliance with the rules. Part of the difficulty of that demonstration of compliance is that when the guidance changes or is contradictory, or you don't have a clear direction as to how to implement it, that's going to be a challenge. But that's where the next slide does encourage that you establish a plan, you document, you publish, you enforce, you update, and above all, you document. And that's the critical piece. If you do get a claim that somehow relates to COVID-19, and this Immunity Act does apply to any tort claim or cause of action for damages, losses, or other relief arising out of, based on, or in any way related to exposure or potential exposure to COVID-19. So if COVID-19 is anywhere in the claim, it potentially has, or this act does apply to it. So you have to bring out all of your compliance documentation to demonstrate that you are entitled to assert the defense. Now I see there are some questions relative to the landlord's relationship to a tenant, and I know one of them was directed at Dom. So I'll let.
I can't click on it.
Okay. Well, it's that you mentioned the landlord's responsibility to require a tenant to maintain accurate visitors list for tracing purposes. Does this include the landlord being responsible for follow-up confirmation and or tracing by the landlord?
So I would suggest to follow up, at least on, if it's a biweekly, monthly basis, to make sure not only if you are a landlord and you have, say, a secretarial position that greets people at the front, make sure the secretarial position is keeping track of adequate contact with who's coming in and out, but also requiring the tenants. I would strongly encourage making sure that those tenants are keeping track of who is coming in and out of that space, just to ensure that liability, if it were to arise later down the road, couldn't be traced back to the landlord. Well, the tenant has to say, well, my landlord didn't tell me I had to do that. How did I know I had to do that? So I mean, it's as a practice, I think it would be important to continuously check in on your tenants, like I said, bi-weekly or monthly basis, to ensure that they are complying with that contact tracing element.
And that does probably lead into the second question regarding the immunity. Can the landlord structure a lease requiring the tenant to comply with all regulations and guidelines and therefore accomplish the immunity? So kind of as a follow-up to that, and I think, yeah, it may be a little late to amend the lease to specifically require it, but I think if you do have a requirement in the lease for the tenant to comply with all governmental orders and regulations and laws and things like that, that may be something that you can remind the tenants of their obligation, and perhaps, like Don said, follow up and send them periodic communications encouraging compliance in order to take full advantage and avail themselves of the protections of the Immunity Act, because it also applies to them. Because as potentially an employer or another place holding its business open to the public. But that also leads to the continuous plug for the Government Affairs Committee to get as many people involved in this process as possible. You can make a difference. The BOMA was there during the development of these bills in trying to make sure that there were as many protections as possible and to just get the bills passed, because there was a significant counter effort to keep the bills from passing, which we've seen was successful at the federal level, but we were able to get some compromise language through at the state level.